I figured a whining noise, you would recognize it as me.
I should have. You're right.
So shall we start today's meeting? We have a couple items on the agenda. We can begin recording. Welcome to the extra inning edition of the Public Health Committee. We have two bills referred to us today to consider for moving forward to the floor. And let me pull those up. I will find them in a moment. Okay, let's start with remarks from the chairs. Good morning, Senator Dougherty Abrams. Could you please share with us your morning greetings?
Good morning, Representative Steinberg. And I do give greetings to everyone on the committee. It's nice to be back together, and I hope you all have been doing well. So we have two bills to do today, as Representative Steinberg said, and some of us actually have other meetings going on as well. So we're in the same position we've always been in, where we may be coming and going, but we will give this our full attention.
I hear you, Senator. We'll pick up the pace a little bit. Good morning, Senator Wong.
Good morning, Mr. Chair. It's good to see you again. And indeed, I hope this will be a quick meeting, but nonetheless, I know people have other meetings, and it is good to see you and everyone.
Thank you, sir. And Representative Pettit.
Thank you, Mr. Chairman. Appreciate you scheduling the meeting on a cool and rainy morning. I appreciate your timing, sir.
We will consult the weather in the future for any other meetings we have in mind. Is Senator Summers here? I don't know if I see her. In any case, I'm sure she is also caught up in the multiple meeting conundrum. We have two items on today's agenda. Again, if I could just put my hands on them, I had them for a second there. Here we go. The first one up is substitute for House Bill 6317, an act prohibiting discharges from nursing homes and residential care homes to temporary or unstable housing. This is a JF to the floor. Do we have a motion?
So moved.
And a second?
Second.
Yeah, it's like you guys forgot how it works. We haven't met for a week. All right, it's been moved and seconded. Are there any comments with regard? Let me give you a little description of this bill. This is a bill that has come up in human services in the past. Its intent is to assure that there are appropriate discharge plans for anybody being discharged sort of into the public sphere where there's concerns, where they may end up being homeless in a homeless shelter or other unstable environments. Apparently, this is effectively current law, but this clarifies the necessity of providing those appropriate discharge plans before the individual is discharged from a care facility. So pretty straightforward in that regard. It's a bill that Human Services has been working on for a couple of years, and I believe it passed unanimously out of the committee. I'll open it up to comments and questions.
Mr. Chairman.
Representative Betts.
Thank you. I don't know that you saw my hand.
I can't see you.
Oh, there we are. Okay. The question I have based on your summary is, should I infer that the discharge plans have not been followed according to the regulations and industry practices?
My understanding, and again, I've gotten this like third hand, so bear with me, is that yes, there is concern that it is not being uniformly applied in the appropriate way and that people are being left in very difficult situations that might have been avoided had good planning actually taken place. So to some degree, this is simply reinforcing existing law, but it's also clarifying the obligation.
And I certainly support that. And thank you for that answer. The question comes to my mind before it came to the legislature. What steps, or does DPH not have the ability or power to be able to change those bad practices?
That's a really great question. I should have asked that myself when I was talking to the chair of that committee. I don't have a good answer for you other than I believe this is an intent to make sure that all parties are aware of their responsibilities and follow through. I think also, to your point, I don't know what kind of teeth this has in any regard other than the standard fines the agency can apply, but this may actually facilitate them holding homes accountable. I'm speculating to some degree.
No, I know it was in another committee, so I wasn't trying to put you on the spot, but it does strike me as curious that we have to pass a law for something I would have thought there would have been some kind of agency or regulatory outline on what could be done if people were not following good practices before this was brought up to become a law. So thank you very much.
Thank you, sir. I think this may be an example of how we have to get it right the second time. Maybe we just didn't close all the loopholes in the first time. Representative Pettit, followed by Representative D'Amico.
Thank you, Mr. Chairman. On 6317 here, the Connecticut Association of Healthcare Facilities has some concerns that I'm not sure the initial committee addressed. They were wondering whether or not this bill would discourage homes from taking admissions if they had come from a previous homeless situation and wouldn't have the guarantee that they'd be able to get into a stable place afterwards. And I think they suggest that perhaps there needs to be funding for this so that they would readily take people who came from homelessness so they could be discharged into a stable situation. When your discussions with the chair, were there any comments about amending this or making it more likely that the nursing homes per se would be protected and not left caring for someone in a custodial manner and not receiving payment because the person was no longer meeting the criteria for care?
That's a very valid question. Thank you, Representative. I would say that in my conversations with the chair, she did not offer up any specific amendments that were to take place subsequent for this bill reaching the floor. She gave me the impression she had been in an ongoing, and I mean extended period of months, conversation with all the parties. And I guess I'd also respond to you by saying that, again, this is effectively clarification and reiteration of current law. If these facilities had been accepting people and then basically turfing them out into the wild, and I use that extremely advisedly, that was a problem in the first place. And yes, do we have a broader issue of homelessness and appropriate places for everybody? Yes. I happen to think this state, for the most part, has done a great job. A lot of it goes back to Governor Malloy's efforts to end homelessness. There are a lot of great programs. I think, to your point, the whole purpose of the discharge plan is to take advantage of existing resources and make those connections. And if they are really made more accountable to make sure that those connections happen, in theory, it should reduce the number of homeless people. So perhaps I'm slightly naive to believe that we really have homelessness well addressed. We certainly know that's not true in every community, but the whole idea is to facilitate the best outcome for the individual being discharged, if that answers your question.
Well, I mean, I understand. I guess their concern is they're sort of looking for a hold harmless kind of a approach. If they take someone who came from an unstable or homeless situation, take them for the post-acute care from a hospital discharge, the person improves and now has basically is being housed there under the regulations. It wouldn't be reimbursed for merely housing someone. So are we in a situation such that we need to provide the ability for people then to go somewhere else or to provide payment to the facility that's caring for them until such a situation can be found that's stable? I think that's their concern, that they'll continue. I don't think their thought is that they're just going to kick people out into the wild, but if they're continuing to provide housing and meals and et cetera for someone, that they want to be reimbursed for their costs. And I think that's the concern, if I understand it. Thank you.
It is a good question. And to your point, it's a broader issue that needs to be addressed. Once again, it comes down to funding. Perhaps that was not included in this bill to avoid making it a large funding issue, but rather to see if we could do the best we could within existing law. But again, I'm speculating. I have not read any specific minutes of the hearing that they had, so I could be missing something. Representative D'Amico, followed by Representative Terziak.
Thank you, Mr. Chair. I just wanted to point out something. What I gleaned from the OLR report on this bill is that this bill goes a little bit further. It doesn't just reiterate what's in existing law. According to the OLR report, under current law, they're prohibited from transferring someone to a place where they might be in imminent danger. Whereas this bill goes a little bit further and says that you can't be transferred to a place where there is unstable or temporary housing. So it to me, it's a little bit of a higher standard. At least that's the way I read it. So for whatever that's worth. Thank you, Mr. Chair.
Thank you, Representative. And you are correct. It does intend to, I would argue that from what I heard, the original intent was to make sure people were not discharged into bad situations. And I use that term advisedly as well. And this is to some degree expanding that to indicate other places where the outcomes could be poor, and to have that at least considered in the discharge planning and every effort made to make sure the supports that are necessary are available. Little bit of reading between the lines on my part. Representative Terziak, followed by Representative McCarty.
Thank you very much, Mr. Chair. I have concerns with this bill similar to one that we passed out of our committee, and that's about including residential care homes. When we want them to, they're their patients' homes or their clients or their residents, probably residents' homes, and we should respect that. And yet we have no trouble going and saying and treating and putting them like their nursing homes with that kind of staffing level. We had assurances on our bill that residential care homes were that those words would be being deleted because we were aiming more specifically at real institutions of care and treatment facilities. Boy, would I like to see something like that about this. What residential care homes need is, what a surprise, more money to pay staff better. Everything else from that I'm opposed to. I don't like this bill. I'd like to vote against it. Let's see how it goes. Thank you very much.
Thank you, Representative. And do you have constructive suggestions, presuming this bill does pass out of committee? I would invite you to take it to the chairs and perhaps they would contemplate changes. Again, the funding issue is fundamental and broader than certainly the intent of this bill, but your point is well taken. Representative McCarty, followed by Senator Huang.
Yes, good morning, Mr. Chairman, and thank you for this opportunity to make a few comments. I too have some concerns about the bill, but I understand the intent of the bill is a good one. We want to do all we possibly can to protect those nursing home residents that may be discharged to unstable housing. And while there may be state and federal laws in place, I think there is a loophole here, and we want to be sure that we cover that. And it brings me to the question, I was reading about the new program, the Connecticut Supportive Housing Initiative, that will be in place very soon, and it will accommodate quite a few individuals. I think the capacity was up to 850 individuals, and I think that would be an appropriate answer to this. If there was some way, and I go along with Doc Pettit, with Representative Pettit making the comments, perhaps there could be some form of amendment on the floor that would have a good compromise, that we wouldn't be hurting the nursing home industry anymore by saying, look, when you have a discharge, that you go and the accommodations are made through this program if the person has no other place to be discharged to. I think it's a good answer, and maybe the committee at the time that this was put in place was not unaware of this program coming forward so quickly. So that's my only concern. I am going to support it because my ultimate responsibility is to the care of the nursing home residents, and to be sure that when they're discharged, we don't want to see a vicious cycle and then they're, maybe end up in an emergency room or a hospital. We want to be sure that they're taken well care of. But I would ask if it's possible to have the conversation continue so that we could get the appropriate language in place. And also, I don't think the current proposal really defines unstable housing correctly. I received some information that what about a respite care that is under a certain amount of time? Couldn't they, if they're going there, that might be appropriate, but this bill would not address that. So those are just my comments. Hopefully we can get it right before it ends up in final passage. Thank you, Mr. Chairman.
Thank you, Representative, for those very sensible suggestions. And presuming again that we pass this out of committee today, I would encourage you to have that conversation with the chairs of the Human Services Committee. I know they want to make this bill right. As I said, they've been working on it for some time, probably before the supportive housing option was as well defined as it is now. So I think you make some really good points, and I'm sure they'd appreciate any improvements to the bill before it's brought out on the floor. So thank you for that. Senator Huang.
Thank you, Mr. Chair. Just a couple of questions from the standpoint that the problem that this is looking to address. Is it a significant enough of an issue? Has it been documented? What's been your perspective from the standpoint of the problem that this bill is trying to address?
Thank you, Senator. I confess that I've not seen specific testimony that addresses the background to the degree that you have asked. I don't know if there are any members of the Human Services Committee in our committee who might have some insight into that. I myself could not give you that requisite background.
And I think it's important to get that kind of balance, as Representative Pettit addressed. There was some concerns in regards to pointing out that the entire industry may be bad actors, and I know that's not always to be the case. But I did want to point out on record to say that if this is indeed an issue, that we clearly need to address it. But nevertheless, I think we have to validate some of these relevant issues in order as we kind of prescribe legislative solutions to it. That being said, I also want to ask and confirm that this is an extension of the governor's current standing executive order. Would that be correct?
I am not familiar with an executive order that is mirrored by this bill. I confess that given that there are over 300 executive orders, I'm not up to speed on all of them quite yet. So again, good question. I don't have an answer for you.
Maybe through you, in reading the testimony of the Commissioner DSS, I did understand that to be, but if OLR can clarify that this is indeed an extension of the executive order, that would be helpful. Through you, Mr. Chair.
Thank you, sir. We will certainly inquire of our OLR crack staff, assuming that they are here with us at this moment.
Hi, Representative. This is Nicole from OLR. I'll need to look into it and get back to you.
Thank you very much. Okay, you have any other patter, Senator Wong? I mean, we've got some time now.
Well, no, I also wanted to point out that that DSS has initiated a program as the former ranking in housing and also now in planning development, and recognizing that housing is a critical concern. It also extends to individuals that would be discharged from facilities that we're talking about, that housing is important for them as well. And I want to acknowledge and highlight the current program that's about to go into effect, that it's called the Connecticut Housing Engagement and Supportive Services, which is using an integrated model where multiple service organizations are talking to each other and coordinating their expertise and referral services to best serve individuals that are being discharged so that they have a stable foundation and setting of housing. So I think that's important, and I think the DSS commissioner in their testimony clearly said that that transient nature of individuals that are in that population that gets discharged without a solid foundation of housing is a continuation of a problem that we are not solving. So I wanted to give a highlight and to focus that indeed the new program that's being initiated is something that we should look at from a public health consideration, but also from a housing and accessibility consideration for a broad population, not just any specific segment, but for this population that it's equally important to be cared for and have accessible housing. That was just my pitch and complimenting their insight in creating that kind of a program. And I hope that we'll continue to support these kind of initiatives in diverse and accessible housing for everyone. Thank you, Mr. Chair.
Thank you, Senator. That was a great pitch, and I really do appreciate your connecting the new program, as Representative McCarty did, with the intent of this bill, which is to make sure discharge plans account for the ultimate disposition of every patient or resident in a fashion in which they're in a safe and healthy environment. And adding to the capacity of supportive housing is part of that solution. And it seems like maybe this bill is quite timely, that maybe we're going to be able to match resources with that plan more effectively than we have in the past. Nicole, have we anything approaching a response to Senator Wong at this juncture?
We're still looking into it since it's a human services bill, and we'll get back to you as soon as we get the answer.
All righty then. We can continue to wait for that response, Senator Wong. I do not see, well, hang on one second. I actually have to make sure.
Mr. Chair, if it's okay by everyone in the committee, I'm happy to follow up and get that information. It does not impact my decision-making. This is a well-intentioned bill. I look forward to supporting it. I just wanted to be sure that as we enact legislation, following through on the executive order, that we rely on a consistency, and that as we make policy changes that stand into law, that we understand the consequences of it. But nevertheless, this is well-intentioned. I'm looking forward to supporting it. And that being said, I can get that answer later. Thank you, Mr. Chair.
Thank you, Senator. We do have another question from Representative Pettit. Maybe that'll afford a little more time. Go ahead, sir.
Yeah, thank you, Mr. Chairman. Just a statement. Acting Commissioner Gifford's testimony in her first statements note that says that subsections 3 and 4 of Governor's Executive Order 7XX suspended the authority of nursing facilities to discharge patients from their facility to temporary unstable housing. So she clearly references Executive Order 7XX in her testimony. Thank you, Mr. Chairman.
Thank you for that specific clarification. Obviously, just to be clear, we must make distinctions between executive orders, which are temporary and an emergency in nature and are intended to expire, and our job as legislators, which is to take maybe aspects of those things and make them virtually permanent through codification, so that the executive order in and of itself will expire, but this bill will seek to extend the life of what is considered an effective means of dealing with a problem, and also deal with something that was long-standing before the pandemic.
It would seem, Mr. Chairman, that this bill also may need a referral. Human Services, Public Health, not a housing. The CHESS program referred to, I think, by Representative McCarty. There seems like there needs to be some connection between the intent of this bill and what happens in real life to protect both the stable housing situation of people who are discharged and the position of the nursing homes who don't get left caring for people without payment.
It's an interesting point, Representative. Maybe something we communicate up the line. I've never fully understood the logic of referrals of bills, but that makes some sense to me. Any other comments or questions? If not, Madam Administrator, I believe we're ready for the vote. Do we want to do a voice vote, or let's do a roll call? Just makes it easier.
Senator Darty Abrams,
Senator Darty Abrams votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar, Senator Kushner,
Senator Kushner votes yes.
Representative Gilchrist. Senator Wong,
Senator Tony Huang votes yes.
Senator Summers. Representative Pettit,
Representative votes yes, but clearly the bill needs some improvement in language in terms of protecting both the people being discharged and the facilities that are caring for them. Thank you.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger Givallo,
Representative Berger Givallo votes yes.
Representative Betts,
Representative Betts votes no with the goal of making sure that the question raised by the member will be addressed when it comes to the floor. So my vote is a no.
Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Representative Dauphiné votes no to reserve her choice of changing that on the House floor.
Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott, Representative Foster,
Rep. Foster votes yes.
Representative Jango,
Representative Jenga votes yes.
Representative Green,
Representative Green votes yes.
Senator Haskell,
Senator Haskell votes yes.
Senator Kasser, Representative Cavros DeGraw,
Representative Cavros DeGraw votes yes.
Representative Kennedy,
Representative Kennedy votes yes, knowing that this bill still needs some work and to see what the bill will look like when it comes to the floor. Thank you very much, Madam.
Representative Kennedy, you need to turn your camera on, please.
I'm sorry?
I did not see you on screen. I think your camera
I'm
is
so
off.
sorry.
Representative Kennedy,
Okay, I'm here. Representative Kennedy votes yes, knowing this bill still needs some work, and I look forward to seeing the new in progress when it comes to the floor. Thank you, Madam.
thank you. Representative Claritas Detrier,
Representative Claritas Detrier votes yes, with hopeful changes when it comes to the floor.
Representative Lenahan,
Representative Linehan votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Senator Moore,
Senator Moore votes yes.
Senator Moore, I did not see you on screen, please.
Senator Moore votes yes.
Thank you. Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon, Representative Tersiak,
Representative Tersiak votes no.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes yes.
Senator Anwar, Representative Gilchrist, Senator Summers, Representative Elliott, Senator Kasser, Representative Scanlon. Thank you, Mr. Chair.
Thank you, Madam Administrator. We will be holding the votes open for roughly an hour upon conclusion of today's deliberations.
Representative Steinberg, I'm sorry to interrupt, it's Nicole again from OLR, and I was able to confirm that it does codify Executive Order 7XX.
Thank you for that. I hope everybody voted with that presumption. Now that it's confirmed, we do appreciate it, and thank you for your timely turnaround. We have only one other item on the agenda today, which is House Bill 6509, an act concerning school-based mental health clinics. This comes to us from the Kids Committee, as it's often known as the Children's Committee, and it's a JF to the floor. Do we have a motion?
So moved.
Second.
Moved and seconded. This is a bill which seeks to address something we've talked about a fair bit in our committee, the need for adequate mental health services for young people. And the intent is to develop a plan to address gaps in the availability of such services throughout the state. My understanding is that both DPH and DCF have weighed in on this because of, in our usual Byzantine fashion, they both have responsibilities depending upon what kind of facility you're talking about. I've been in conversation with the chair of committee, who happens to be with us today, and also with the proponent of the bill, Representative Wheelander, and they have listened to the suggested comments from the two agencies and are amenable to an amendment which will shift responsibility currently held on line 44 of the bill by the Department of Public Health and transfer that to the Department of Consumers, Families, Children and Families. So the point is, the proponent of the bill and the chair of the committee are prepared to make this change. They have asked that rather than do so now, which would delay the availability of the bill for the floor, that we pass this bill out of committee and allow them to introduce an amendment on the floor, which would address the glitch that was brought up by the agencies. Are there questions or comments? Representative McCarty.
Thank you very much, Mr. Chair, for that explanation. And I'm pleased to hear that the chairs of the Children's Committee will be interested in an amendment, because the bill as written is pretty confusing as to who is going to be in charge of what. So given the remarks you just made, would the Department of Public Health still be in charge of the current school-based health centers that also provide mental health and behavioral services? This bill, I think, seeks to expand that so that the clinic is open to more, I think, in the community. Is that the intent underlying it? I know, first I want to preface these remarks by saying there is an absolute need for more mental health services. We know that this pandemic exacerbated that. There's no question there. So I'm very supportive. I'm just wondering why maybe we didn't look to expand what we currently have, since we are offering mental health services and behavioral in the current school-based health clinics, why it wasn't more an expansion so we have more school-based health clinic. That I'd be favorable to as well. I'm not opposed to this bill, but I'm just trying to understand what it is seeking to do that we can't currently do. And if that new effort is going to be put over to the Department of Children and Families, will they be working then with the Department of Public Health on the current? I'm just still, I still need a little more clarification, if you don't mind.
Well, thank you for the questions and comments, Representative. I think you're right to highlight the intent of this bill, which is to develop a plan which addresses gaps that currently exist and make sure there's an adequate network of such services available across the state. And to your point, perhaps the ideal solution would be to fund a bunch more centers. And perhaps that will be an outcome of this process where the plan identifies where it needs to be. We can dimensionalize the cost and therefore make a cogent request to appropriations for long-term funding. Rather than speculate further, though, I will use my lifeline and ask the chair of the Children's Committee, Representative Linehan, if she would like to comment or clarify, if that's all right with you, Representative.
Absolutely.
Yes,
Thank you.
Oh, sorry, Representative Linehan. I just wanted to say too, and I wanted to point out, I think that this bill is to give DPA that authority to develop a plan. So yes, thank you, Representative Linehan.
Thank you very much. And through you, Mr. Chair, to the good representative. That's exactly what this is. It's really just charging a plan. So there's no mandate on any schools. No changes are going to be made at this point. It's really to get the proper people together to look at where those problems are, what needs need to be filled, and then develop a plan to fill those. And the good chair is right. If the plan says that more funding is needed, then that's going to come back to the legislature to try to get them more funding. I think the first thing that we need to do is look at the holes in providing mental health services for children in these already existing centers. So it really is it provides the option for mental health only, but then it can also be expanded within the current centers. It's really, I can't reiterate this enough, and I'm sorry if the bill isn't clear, but it's really just developing a plan, looking at the issues, developing a plan to fill those holes, and coming back to the legislature with that. There is no mandate, there's no changes being done through this bill. And so if there is anything that needs clarification, an amendment on the floor would be fine for that purpose. But if you read through, I believe that it's pretty clear. But if clarification needs, that's no problem. Representative Wieslander, who is the proponent of this legislation, is open to that and working on that. And as the chair of the Children's Committee for this House bill, I will certainly bring that amendment to the floor if it's needed. Thank you, Mr. Chair.
Thank you. Representative McCarty, are your questions all answered?
Yeah, well, I very much appreciate Representative Linehan and the intent of this bill. So I will be supportive of the bill today, but I do still think that I believe that in looking at a plan will answer a lot of the questions that I have. So I'm happy with that response. Thank you, Mr. Chairman.
Thank you, Representative. Representative Pettit.
Thank you, Mr. Chairman. A follow-up question. I'm still confused that the acting commissioner of public health testified that she, as I understand, she really didn't feel that this was necessary, and that if it expanded their role, they would need more staff and more resources to do so. Now there's been a suggestion made that this could go to DCF, so I assume that would mean that DCF would need more staff and more resources. So back to the original thought, could we not just expand the current programs under the current school-based mental health clinics as they stand? The good representative referred to holes. Are there holes because not everyone has access to that? Are those the holes we're attempting to fill? Through you, Mr. Chairman. Thank you.
Thank you for that, Representative. My understanding is one of the reasons the DPH was talking about additional staffing is they would need a specialist with specific background. And again, I'm surmising that DCF has somebody with that requisite background, and making the amendment shift as suggested would mean that it would be going to somebody with the expertise and with the ability to take on this additional task. But once again, if you're amenable, Representative, I will pass it on to Representative Linehan, and maybe we don't need to speculate. Representative Linehan.
Thank you.
Thank you very much, Mr. Chair. And through you, so I want to be very clear that the addition of DCF is because DCF is a bifurcated agency, right? So they have the child safety arm, but then they also have the mental health arm. So there's the option that a school-based health center be opened just as a mental health center. And then there's also the option of adding on to the current school-based health centers. However, I just want to state that the testimony provided was on the original bill, and we put forth substitute language. So the original bill did call for the expansion of these centers. What the substitute language does is instead it pares it down that says we need to study, and I hate the term study, you know, that's one of my issues. But it really does say that we need to look and make a plan. So instead of just doing a typical study, it's actually an action to make a plan to see what we need to do in order to have better mental health in these school-based health centers. Does that mean that it needs to be through the mental health arm of DCF and doing just simply mental health centers within these areas? Or does it mean an expansion of existing centers to include mental health? Or does it mean that we open up new clinics that include mental health? And so we're really asking all the questions in order to be able to support kids in need, especially through this pandemic.
Thank you,
I hope that's
Representative.
helpful.
Representative Pettit, do you have any?
No, that is very helpful and clears it up. So through you, I thank the good representative for that clarification. Thank you, sir.
Thank you. It's very handy to have the chair of the committee in question available to us at our beck and call. And for that, I'm very appreciative because we didn't have to speculate. Are there any other comments or questions? Seeing none, Madam Administrator, I believe we're ready for our vote today.
Senator Darcy Abrams,
Senator Darty Abrams votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar, Senator Kushner,
Senator Kushner votes yes.
Representative Gilchrist, Senator Wong,
Senator Tony Huang votes yes.
Senator Summers, Representative Pettit,
Representative Pettit votes yes.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger Givallo,
Representative Berger Givallo votes yes.
Representative Betts,
Representative Whit Betts votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné, Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott, Representative Foster,
Rep. Foster votes yes.
Representative Zengo,
Representative Jenga votes yes.
Representative Green,
Representative Green votes yes.
Senator Haskell,
Senator Haskell votes yes.
Senator Kasser, Representative Cabras DeGraw,
Representative Cavros DeGraw votes yes.
Representative Kennedy, Representative Caritas Detria,
Representative Claire Destetria votes yes.
Representative Lanahan,
Representative Linehan votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Senator Moore,
Senator Moore votes yes. Senator Moore votes yes.
Thank you. Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon, Representative Terciak,
Representative Terciak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes yes.
Senator Anwar, Representative Gilchrist, Senator Summers, Representative Dauphiné, Representative Elliott, Senator Kasser, Representative Kennedy,
Kennedy votes yes.
Representative Scanlon. Thank you, Mr. Chair.
Thank you, Madam Administrator. And once again, we will hold votes open, let's say till 11 o'clock this morning for those who have not had an opportunity to vote. If you want to contact any of your colleagues who may not be aware of that, I'd appreciate it. And lastly, if you have any comments or suggestions with regard to the many bills that we passed out of committee, we've been working very closely with LCO to polish up a number of those bills, but there's still opportunity on some of them to have input. And we encourage that because we had a lot of good questions and comments during our public hearings and debates. As far as our next date and time of our next meeting, don't know. There may not be one, but stay tuned. Very much appreciate your ability to get together today to address these two bills, which will now be moving to the floor. Madam Co-Chair, anything else you would like to add?
No, thank you, Representative Steinberg. Great job today.
Thank you. So we are in recess until 11 o'clock. Thank you all for your contributions. See you later.
Bye-bye.
Have a great day, everybody.
How's it going?
Hi, Representative Elliott. How are you?
Good.
How would you like to vote on House Bill 6317
Rep. Elliott votes yes.
and on House Bill 6509?
Rep. Elliott votes yes.
Thank you.
Thank you.
Have a great day.
Rep. Elliott?
Mm-hmm.
I'll email you. Never mind. Thank you.
Okay.
Hi, Beverly.
Hi, Representative Dauphiné. How would you like to vote on House Bill 6509 and act concerning school-based health center health clinics?
Representative Dauphiné votes no.
Thank you.
Thank you, Beverly.
You're welcome. Hi, Representative Scanlon.
Hi, how are you?
I'm well, thank you.
I'm a yes on the bill.
A yes on the first bill, 6317,
Yes.
and on the second bill, 6509,
What's the title of that bill?
and act concerning school-based mental health clinic.
Yes. Was that bipartisan support?
Yes,
Okay, then yes.
thank you.
Thanks. Bye.
Bye.
Hi, Senator Kasser.
Oh, hi, Kate. How are you?
Oh, I'm good. Let me start the recording. Beverly had to leave.
Okay.
Okay, and how do you vote on House Bill 6317?
Senator Castro votes yes.
And how do you vote on House Bill 6509?
Senator Castro votes yes.
Thank you so much. Hope have a
Thank you,
good day.
Kate.
Bye-bye.
Take care. Bye.
Hi, Senator Summers, how are you? Hi, Senator Summers. You're muted.
Hi, how are you?
Good, how are you? How do you vote on Bill 6317?
Can you give me the titles of the bill? Because I don't know by the number. Sorry, I know by the
Oh,
title.
it's okay. One moment, please. Uh, 6317 is an act prohibiting discharges from nursing homes and residential care homes to temporary or unstable housing.
And I'm a no on that one.
Okay.
Where are we going to put those people?
There was a conversation about an initiative.
On the nursing homes, because if not, the nursing homes become like a shelter if you can't discharge a patient. You know, it's not the nursing home's responsibility to find permanent housing. That puts them in a, they're already barely hanging on. Did anybody talk about that at all?
There was a conversation about that.
Okay, I'm a no on that one. I'm sorry.
No, it's okay. It's and then the other bill is
I'm a yes on the mental health bill.
Mental health. Okay, so that's a bit raised House Bill 6509, and you're a yes.
Yes, that's for a study to look at DPH. Yeah. Okay. Yep.
Okay, great. Thank you so much. I appreciate it.
Okay.
Your glasses.
Oh, thanks. I can actually see now.
It's wonderful, isn't it? Here, Sam.
Thanks. Let's see yours. Oh, I like. Hey, those look like my pink ones, except they're blue.
Blue, yeah, they're
yeah. I like the blue.
The blue is good.
It's blue. Is good. All right.
Thank you. Bye bye.
Hey, Bev, are you there?
Hello, Representative Gilchrist. One moment, please.
Okay, thanks.
Hi, so welcome. How do you vote on raised House Bill 6317?
Yes.
Okay. And how do you vote on raised House Bill 6509?
Yes.
Okay. Thank you very much. I appreciate it.
Thank you. Have a
Bye.
good one.
You too.
Bye.
How are you? Hi, Senator Edward. How are you? It's so good to see you.
Sorry for being a little late for the vote.
Oh gosh, no, don't apologize. How would you like to vote on House Bill 6317?
Senator Anwar votes yes.
Thank you, sir. And how would you like to vote on House Bill 6509?
Senator Anwar votes yes.
So thank you so much. I really appreciate it. Happy have a
Thank
good
you.
afternoon.
Thank you. You
Thanks.
too.
Nice to see you.
Good to
Bye.
see you too. Bye.
homes.